Hello everyone. So here in this video I'm going to discuss about the osteology of the thoracic vertebra. First of all, you all know that there are 12 thoracic vertebra, out of which we have second to eighth are typical, and then first, ninth, 10th, 11th and 12th are typical. Okay, second to eighth are typical. First of all, let's discuss how to identify that this is a thoracic vertebra. For identification purpose, you should know that in a general feature of a vertebra, that it has a body, the neural arch and a spinous process. Okay, now here this in case of the thoracic vertebra, on the side of the body we have presence of costal facet over here. The costal facets are present over here, which will articulate with the ribs. The costal facets may be two or only one on each side. Okay, now coming to the features of a typical thoracic vertebra. First of all, regarding the body is heart shaped. Okay, and the anteroposterior and side to side measurement is almost similar. The side of the body has costal demifacet. The superior costal demifacet is larger than the inferior costal demifacet. The superior costal demifacet lies near to the upper border of the body, and the inferior costal demifacet lies to the lower border of the body. Okay, now the superior costal facet will articulate with the head of the facet, the larger facet present on the head of the corresponding rib, and the inferior costal facet will articulate with the rib which is present below this vertebra. Okay, suppose that this is T4 vertebra, then superior costal facet will articulate with the lower facet of the head of fourth rib, and this inferior costal facet will articulate with the upper facet present in the head of fifth rib. Okay, I hope it's clear. Okay, now regarding the vertebral foramen, the vertebral foramen is comparatively it is small and circular. The vertebral arch, in the vertebral arch we have the pedicle, we have the lamina. Okay, so there is a pedicle and lamina along with the posterior surface of this body joins together to form this vertebral foramen. Okay, so this is the vertebral foramen which lodges the spinal cord. Now, the vertebral arch, the pedicle are directed straight backward. Okay, the superior vertebral notch, this is the superior vertebral notch which is shallow because the pedicle is attached to more towards the upper border of the body of the this thoracic vertebra, and the inferior vertebral notch is deep. Okay, the superior vertebral notch is shallow and the inferior vertebral notch is deep. Now coming to the lamina overlap each other. Okay, and it will continue here. You can see this part is the lamina which joins here in the midline, and then posteriorly this will form the spinous process. Now regarding the articular process, the superior articular process projects upwards from the junction of the pedicle and lamina. The articular facets are flat and are directed backwards. Here you can see it is directed backwards, and the inferior articular facets are fused to the lamina. The articular facets are directed forwards. Here you can see the articular facet. This is the inferior articular facet. Here this is the inferior articular facet, and this is the superior articular facet. The transverse process are large and are directed laterally backwards. Here you can see this is the transverse process. The anterior surface of this transverse process bears a facet on which the tubercle of the corresponding rib will articulate, and it will form the costo-transverse joint. The spine is long and is directed downwards and backwards. So you can see the spine is long and directed downwards and backwards. Now coming to the attachment, the upper and the lower border of the body in front and in behind here will give attachment to the anterior longitudinal ligament and posterior longitudinal ligament. Okay, the upper border and the lower parts of the anterior surface of the lamina here. Lamina will give attachment to ligamentum flava. Now coming to the attachments on the transverse process. On the tip of the transverse process, there is attachment of lateral costo-transverse ligament. On the anterior surface, there is attachment of superior costo-transverse ligament. On the anterior surface, there is attachment of inferior costo-transverse ligament. On the inferior border, there is attachment of superior costo-transverse ligament. On the upper and the lower border, there is attachment of intertransverse ligament. Okay. Now, coming to the attachment on the spine. Okay. The spine gives attachment to supraspinous and interspinous ligament. They also give attachment to some muscles like trapezius, latissimus dorsi, serratus posterior superior, rhomboides, okay, and the serratus posterior inferior. So these are some muscles which are attached on the spine. Ligaments which are attached on the spine are supraspinous and interspinous ligament. Then muscles are attached: trapezius, rhomboides, latissimus dorsi, serratus posterior superior, serratus posterior inferior. Okay, so this was about the features and attachment of a typical thoracic vertebra. That's all. Thank you.